Is a DATscan necessary for a Parkinson's diagnosis? Imagine trying to solve a puzzle where most pieces fit together easily, but a few are tricky. That's often how diagnosing Parkinson's disease works. Doctors relying mainly on what they see and hear from patients. They look for key signs like slowness of movement, stiffness, resting tremors, and balance issues. These symptoms help experienced doctors make a diagnosis without needing special scans. A DATscan is a type of brain imaging that shows how well the brain's dopamine transporters are working. Dopamine is a chemical that helps control movement, and in Parkinson's disease, nerve cells that produce dopamine gradually die. The scan can reveal if there is a loss of dopamine activity, which supports the diagnosis. But it's important to know that a DATscan is not required to diagnose Parkinson's. Doctors usually reserve DATscan for cases where the diagnosis is uncertain. For example, if someone has symptoms that could be Parkinson's or another condition like essential tremor or drug-induced Parkinsonism, the scan can help clarify. It can also be useful if the symptoms are unusual or don't fit the typical pattern. However, even with a DATscan, it cannot definitively distinguish Parkinson's disease from other Parkinson plus syndromes, such as multiple system atrophy or progressive supranuclear palsy. The benefits of a DATscan include high sensitivity and specificity, meaning it is good at detecting dopaminergic deficits. Studies show that it can influence diagnosis and treatment plans in about half of the cases where doctors are unsure. But because the diagnosis can often be made confidently through clinical examination alone, many experts believe that the scan should not be routine. There are some considerations to keep in mind. A DATscan involves exposure to a small amount of radiation, similar to a year's worth of natural background radiation. While very low, there is a tiny potential risk of cancer. Plus, the scan can be costly and is not always covered by insurance. Because of these factors, it is generally recommended only when the doctor needs extra information to confirm or clarify the diagnosis. In summary, diagnosing Parkinson's disease mainly depends on a detailed medical history and neurological exam by a specialist. A DATscan can be a helpful tool in certain tricky cases, but it is not necessary for most patients. Always consult a healthcare professional to see if this imaging test is appropriate for your situation. Remember, every person's experience with Parkinson's is unique, and your doctor can guide you toward the best approach based on your individual needs.